I don't see two things. The issue of Dr. as a hired by the public hospital and being registered by the medical council the same way it treats everybody else through the media. I was as horrified as any right-thinking person in Guyana could possibly be at the circumstances under which the doctor one got registered and two got hired. But of course what I was seeing was a report in the press, and so I needed some more information. Having gotten the information that he was at the time not registered when in his own country where he was qualified when the medical council registered caused me concern, and of course I asked questions about how this happened. Simultaneously we were asking questions about how he was hired, because for me there's two separate issues. His registration, which is a special matter dealt with by the statutory body, and his employment in GHPC. Somebody like George, like Dr. Prasad, with his, I can't think of the opposite of credentials, but with his background, cannot, in my view, work in a public institution or work as a doctor where he is going to come into contact with women and children. And the first, every effort has been made to ensure that that is given effect to. As far as I know, the medical council is a statutory body. No one can tell them what to do. I believe in the Medical Practitioners Act. There is a provision for the Minister of Health to refer matters to the council, but still you can't tell them what to do. As far as I understand from the Minister of Health, Dr. Asami, the Medical Council has reviewed this matter, has put the charges that are made or the allegations that are made to Dr. Prasad, and has given him time to respond to indicate why he should not be struck off the road. Dr. Asami has also indicated that the Georgetown Public Hospital is going to be terminating the services of Dr. Prasad. I did see a letter in the newspaper today saying that there was deafening silence from him, and perhaps I should apologize, but let me say this. Upon discovering this, for me the only thing that was necessary was to make sure that this horrific thing where we have sexual convicts working in a hospital where the public is going to be exposed to him was to get it reversed. And so I'm not sure, I suspect what the letter writer wanted to me to go publicly and say that. And perhaps the writer is justified in expecting that of the public officer, but quite frankly for me, what was important was reversing that. And we immediately did everything we could to make sure that was not the reality anymore. And yeah. The registration of sexual offenders, well, first of all, we're dealing with two separate acts. I saw people saying under the Sexual Offences Act, but I actually believe it's under the Prevention of Crimes Act. And I think we need to do a little bit more to see if the registration of a person can be done with his conviction being in an unconscious. But for sure, under the Child Protection Act and under the Sexual Offences Act, someone with this kind of background cannot be offered a Which act is that? I didn't see this morning. But I know for us here, if you have convictions in certain matters, you can be registered, go on a register. That was Prevention of Crimes Act the government passed sometime last year. So for me, I am appalled at two institutions. One, the Medical Council clearly ignored the very serious message the government sent repeatedly over the years that we were not going to be tolerant of any sexual offenses against our women and children. We sent that message, it was evidenced by the various policies, the various pieces of legislation, the various campaigns that we've had. They ignored that completely and were blind to it. I am prepared to allow that they made a mistake. And the Georgetown Public Hospital has their employment of this man, where they professed that they knew what he did. And of course, it's only reported in the press. I'm not sure if the man actually said that, Dr. Ramaran. But where they professed that they knew what he did, their employment of this man is baffling. I don't see any sane, right-thinking person doing something like that. And I wonder what on earth Dr. Ambaran means when he says it is only one child. How many children would have to be victims before you consider a matter serious, and which child is worth less than the other? So I really don't believe Dr. Ambaran was thinking intelligently. And if he was thinking, then he really needs to review his perspective on this matter, bearing in mind the laws that we have and his own humanity towards it.